I truly think my dad is one of the last of the great Renaissance men. He's an avid painter, yachtsman, very great sailboat racer, and above all, he was a PhD in chemistry.
My mom was continuing to work by choice. She retired at age 84 and was an administrative assistant secretary for high school.
Initially, I kind of suspected something was up when we were sitting in their lake house talking, and my dad, who never misspoke himself, used a wrong term in the middle of a sentence, and he stopped himself and he went, "Oh, that isn't what I wanted to say." And he did that a couple more times.
Some of her friends at work were the ones who called me and said, "We're getting really concerned about your mom," because I was managing it long distance, and I would see little changes, but it's hard to know what is just normal aging, you know, a little forgetfulness or whatever, and when you're really seeing something different.
Over time, I got a phone call a few months later from a friend of mine up at the university who had found my father wandering around in the parking lot, had misplaced his car in the parking lot, but it was a parking space that he'd parked in for 35 years.
She was very high functioning at first and thought she didn't need it, so it's stressful in every which way. I don't need it, you need some help.
And so I started suspecting something might be up. It concerned me.
I tried to give all those areas of care that I knew she needed, but it was stressful for her to be away from home. It was very stressful for me, still trying to manage my family and my life.
It became apparent over time that some things were going to happen.
I wasn't sleeping at night worrying that I wouldn't hear her if she got up, and I didn't feel like I was giving her what she deserved.
It was amazing how in a one-year period, how quickly the disease advanced within my father, and then my mom went ahead. There are tests. She took him to a neurologist who conducted testing, and they discovered that he indeed did have Alzheimer's.
And I felt like I was just drowning in a swirling pool trying to get the information quickly.
We needed to find some people that understood the disease, that could explain to us the changes that our father was going through.
Alzheimer's disease is a dementia disorder that affects the way people think. It's actually a brain disease. It can affect thinking, reasoning, and behavior. Many times families who are facing Alzheimer's disease don't know where to turn. They don't know what to do, and we felt like we wanted to do a video that will help families on their journey, help them understand what they're facing ahead, and to make it a more successful journey.
Any patient who has symptoms of memory loss or family is concerned about possibly a change in their cognition and function as they're aging should be seen by a primary care physician to have a general medical history and physical and a checkup. You would then have to make sure that physician is comfortable in doing a cognitive evaluation. If the primary care doctor is not, then the other types of physicians that can do that type of assessment are geriatricians, who are physicians who have trained in either internal medicine or family medicine and then do extra training in geriatrics, or another type of physician group would be neurologists that will focus more on the cognitive side.
In the early stages, you can have trouble finding your way to a familiar location. You may start to drive to the bank and forget how to get there, or forget why you've gone to the bank. You have trouble completing simple tasks like balancing the checkbook, or completing the laundry that you might have done easily before. Misplacing things is something that we all do, but in someone with dementia, you may find things in locations where they shouldn't be. For instance, you find the keys in the freezer, or shoes are underneath the couch cushion, things like that. Things that just don't make sense. There can be mood and personality changes that occur with early stage dementia. Argumentativeness, combativeness, their ability to process what's happening in their environment normally is changing.
If you know what you have, you know what the options are for medication management, which are only symptom management. We do not have a disease-modifying drug to date, but we do have symptom management drugs, and so they can be helpful. So an early diagnosis, I think, helps you to become empowered with knowledge about what you have, and then to take more charge in the planning, rather than have it happen to you if you haven't really had that opportunity.
When you're planning how your family's going to work through this next phase of their life, it's really a good idea to have a family meeting. It's an important time to have open discussions involving or led by the person who's been diagnosed. What do they want? What kind of plans do they need to make? Have you designated a power of attorney?
When a person has been diagnosed with dementia, one of the things that they realize is that they're going to have deficits in abilities going forward, and they need to put in place tools to address those, principally powers of attorney. There's two types of powers of attorney. There's a financial power of attorney and a medical power of attorney. Also, there may be medical decisions that are going to need to be made, and they may not be able to communicate those at some point in time. So there are documents that they can put in place to tell their family and their physician and the facility what their wishes would be if certain circumstances occur. One of those is a directive to physicians and family or surrogates. Most people know that as a living will. And another is an out-of-hospital do not resuscitate order. As the disease progresses, the person's cognitive abilities decline, and that person may not have the capacity to execute the documents later, so it's important to do it early.
As Alzheimer's disease progresses, the middle stage is where people start to have more obvious problems. Their mood and behavior changes are very unusual. They have difficulty recognizing friends and family members. Their completion of tasks is really problematic. They may wear multiple sets of clothes. They may forget to bathe. They may forget to eat. You have pronounced changes in memory, much more confusion. You may see problems with the person repeating the same story over and over and over again. Alzheimer's disease can last for many years, and as it's progressed past the 6 or 7 year point and gets to the severe stage, families can find that they need help in providing care. The person with the later stage of Alzheimer's can have great difficulty recognizing familiar people, even their primary caregiver. Their ability to communicate becomes quite impaired. They may not be able to form thoughts and express those thoughts. They can't make their needs known. It may even become difficult to tell if they're in pain or they're hungry. Even those basic impulses become difficult for them to express. Depending on your circumstances, you may find that you're not able to provide the care that your loved one needs alone. You may even need your loved one to go into a residential setting. Activity-based care in a memory care center can work great for people who are still relatively high functioning, they're very social, and they just need some assistance with dressing and maybe reminders to take their medication. But since this is a disease of the aging, there are oftentimes some fairly serious or complicated medical disorders that come along with Alzheimer's disease. So you need a care team that can address both of those types of needs.
What we're looking for in the facilities is 24/7 registered nurse RN care. That way the RNs are trained to notice problems quicker, pick up on them, not just trained in nursing home care so much, but actually in dementia care with all the issues surrounding dementia.
Having a dementia-specific center is very important because it's built on several principles in terms of the environment that's needed, the education, and the programming. So if we look at the environment, they're usually built on principles of person-environment fit, where the appropriate environment will enable the person with cognitive, functional, and behavioral challenges to be able to function more independently through the help of the environment. Secondly, the education of the staff is extremely important. Typical nursing facilities in the state of Texas only require 1 hour of dementia education for the staff. And the staff at a dementia-specific center have many hours of education about dementia. And then lastly, a dementia-specific center has to have appropriate programming so they're able to then do things that are meaningful and enable them to be engaged and have joy because it's appropriate to where they are in the journey of this illness.
If someone's not in the right facility, what's going to happen is the family's going to be receiving a lot of phone calls about the behaviors of their loved one, and the facility may even say that we can't keep them here, which necessitates a second move for their loved one.
It's important when families are looking for Alzheimer's placement for their loved one to remember that the care is the most important component. It's not the pretty lights, it's not the rooms, the apartments, it's the care. So when you're looking for the facility for your loved one, yes, where it's important to make sure that the outside looks nice and the inside looks nice, make sure that this facility will be the facility of choice with trained professionals who will treat your family with the dignity, compassion, respect, and offer them the peace that they deserve.
When families suspect Alzheimer's disease or are facing it, there's a lot of things they need to know to deal with the disease, and we go in detail in our classes on how to do that and how to work with and manage the disease. There's a lot of information on the internet that you can get, but there's nothing like getting it in person and hearing the experiences from somebody that's been through it too. In the classes, we cover what to expect, so we get a really good understanding of the disease and what to expect as the disease progresses, not only for the person with the diagnosis, but what the family can expect also. We talk all about communication, how is it difficult and how to get around that and best ways to communicate. Managing behaviors also. Some difficult behaviors that can come up and how to get around those, maybe avoid them, and what to do when they do come up. Daily care living, just the little things that you do every day, brushing your teeth, eating, showering, and how those change and how to work with your loved one as the disease progresses. Home safety, we talk about home safety, how to make it a safe environment for your loved one. Planning for the future. Whether it's just getting your legal documents in place, like powers of attorney and all of that, to hire and care. Knowing what's out there and the questions to ask when you're looking for that stuff. And then we talk a lot about reducing stress and coping skills because it is such a hard disease. You need to know how to do that. When a family, at the end of one of the classes they've gone through, they are empowered. They have more confidence when they're going in and working with their loved one. And they enjoy more time with their loved one. They know when to look for the good times. And they're less stressed and they have a better quality of life.
No family is prepared for the tidal wave of emotions that come when you have a diagnosis of dementia, but it's really important that you have a plan. You need to know what type of dementia your loved one has initially so that you know what you're going to be facing in the future. Knowledge is power. It's like any journey. You need to be prepared for the journey and you'll have a great trip. With Alzheimer's disease, you need to prepare ahead so that as you go along the journey, you're making the best of your life.